7 huge warning signs and symptoms of type 2 diabetes. Now, diabetes mellitus is quite common, and the most common form of diabetes is actually type 2 diabetes. In fact, 90% of people with diabetes mellitus have type 2 diabetes. Now, we know that diabetes is a leading cause of kidney failure, heart disease. It's a risk factor for many complications. But many people who have diabetes don't even know it. Why? Because they don't know the warning signs and symptoms. Now, if you or a loved one had diabetes mellitus type 2, wouldn't you want to know the warning signs? I thought so. So today, I'm giving you 7 huge warning signs and symptoms of type 2 diabetes. Now, first, let's talk about what type 2 diabetes is. Well, diabetes in general occurs when you have elevated levels of glucose in the blood. Now, all of our bodies, every single cell in your body needs glucose or sugar in order to function and to have energy. And in order for that glucose to get into the cells, you have to have insulin. Insulin acts like a key to unlock the door to the cells in order to let glucose in. Well, in type 2 diabetes, even if you have enough insulin, if you have enough keys, that insulin does not seem to work. In other words, your body's cells are resistant to the insulin. You have insulin resistance. And so even if you have all kinds of insulin, high levels of insulin in the body, the cells just don't respond. So what happens? That blood sugar or glucose cannot get inside the cells, and you get high blood sugar or hyperglycemia. In type 2 diabetes, you can also have a situation where that high blood sugar eventually impairs the pancreas, the cells in the pancreas, from making insulin. And so in addition to initially having a lot of insulin that just doesn't work, and so you can't get the blood sugar into the cells, ultimately you actually have a decreased production of insulin, even in diabetes mellitus type 2. Now, there are many risk factors for diabetes mellitus type 2, including being a person living with obesity, being a person with an inactive lifestyle. There are also some medications that can put you at risk, such as steroids or certain antiviral medications. Diabetes is the #1 cause of kidney failure in the United States, and it is a leading cause for heart disease, poor wound healings, and a myriad of other complications. So now let's talk about the warnings. I'm going to give you 7 huge warning signs and symptoms of type 2 diabetes. 1, increased thirst and urination. So when you have diabetes mellitus type 2 and you have this high blood sugar, well, the sugar has to get out of the body somehow. And so what happens? That glucose is filtered out through the kidneys. Now, glucose is a pretty large molecule. So when you urinate it out after it's filtered through the kidneys, with that glucose, it takes water and some other electrolytes as well. So what happens? You end up having increased urination. And so you're getting rid of the glucose through your urine as well as your water. So you have increased volume of urine, increased frequency of urine, and you may have to get up many times at night having nocturia to urinate. This is the increased urination that can be a warning symptom of diabetes. Well, what happens after you have all of this increased urination? You get dehydrated. Because you are dehydrated, you have an increased thirst. And so a warning symptom of diabetes mellitus type 2 is increased urination followed by increased thirst, polyuria, and polydipsia. 2, fatigue or generalized weakness. Even though you have very high blood sugar levels in diabetes mellitus type 2, that blood sugar is not getting into the cells. Therefore, you're not getting the energy you need. What happens? You end up being very fatigued or excessively tired, or you can have generalized weakness. 3, blurry vision. You can get blurry vision as a complication of diabetes mellitus type 2. This can be a warning symptom. So with all of the shifts of fluid and electrolytes that can occur within the eyes, that can cause the vision to be blurred. But also the blood glucose, those high blood sugar levels can be toxic to tiny blood vessels in the eye, and you can get something called diabetic retinopathy. So blurry vision is another warning symptom of type 2 diabetes. 4, unintentional weight loss. Now, I mentioned that even though with type 2 diabetes, you have elevated sugar in the blood, high glucose blood levels, that sugar is not being utilized properly in your cells. And so it's not going in your muscle cells. It's not going into your fat cells. It's not being processed properly. And so you're not getting the proper energy you need. And so patients with type 2 diabetes may have voracious appetites. They may be eating, but still losing weight. So unintentional weight loss can be a warning symptom of type 2 diabetes. In addition, you can get nausea and vomiting and abdominal pain as warning symptoms of type 2 diabetes. 5, poor wound healing. If you have poor wound healing, this can certainly be a symptom of type 2 diabetes because patients with type 2 diabetes may have cuts that don't heal well. They can get ulcers in the bottoms of their feet that don't heal well. And also, just in general, if you get ill, then you can have a prolonged infection. Why? Because the hyperglycemia, the high blood sugar in type 2 diabetes will cause your immunity as well as your wound healing to be delayed. 6, numbness and tingling of the fingers and toes. This can certainly be a symptom of type 2 diabetes, and it's called diabetic neuropathy. These elevated blood sugars can actually be toxic to your nerves and to certain cells in your nervous system. And so if you are a person and you're noticing that you're getting a pinprick feeling or numbness or tingling in your feet or in your fingers, please make sure you consult with your physician, because indeed, this could be another warning symptom of diabetes mellitus type 2. And finally, number 7, itching around the penis and vagina. Yes, I'm dead serious. That can sound a little shocking, but it can happen. When you have type 2 diabetes, you tend to get more infections. Specifically, you can get more yeast infections. And if you get this yeast, like this candida infection, it can present as a yeast infection in the vagina or in the penis, and it can cause an itching around the penis and the vagina. And so if you are someone who is having itching in your genitalia, if you are a lady and you're noticing that you're having a cottage cheese-like discharge or yeast infections in addition to this itching, then you definitely want to consult with your physician, because this, believe it or not, can be a warning symptom of type 2 diabetes. So these are just 7 of the many huge warning signs and symptoms of type 2 diabetes. And even if, yes, diabetes does tend to run in families, and you may have some genetic predisposition through family history, you can still do something to prevent diabetes mellitus type 2, and you can do so with lifestyle modification. So if you are a person who is living with obesity, meaning your BMI is greater than 30, or if you are someone who is overweight, meaning your BMI is between 25 and 30, then certainly you can do certain things to try to maintain a healthy body weight, such as exercising. According to the American Heart Association, you should be exercising 150 minutes per week of moderate exercise. So that's about 30 minutes, 5 days a week. Also, you should eat a heart-healthy diet that is mostly plant-based. There are many things that you can do to help to prevent diabetes mellitus. And if you do have the diagnosis of diabetes, you definitely want to have a tight control and to treat it. Yes, there, again, are certain dietary changes you can make, but also there may be some medications that you need, such as oral hypoglycemics or metformin or other medications. And even though type 2 diabetes is a disease of insulin resistance, meaning that even if you make enough insulin, your cells are resistant to that insulin, they do not respond to it. Over time, many type 2 diabetics will actually end up making less insulin. That pancreas becomes impaired to making insulin due to all the high blood sugar. I say that to say, even if you are a type 2 diabetic, your treatment regimen may ultimately include insulin. Be sure you consult with your physician as well as with your endocrinologist.